Hello and welcome. Today we're diving into a rare but fascinating condition called Zollinger-Ellison syndrome, or ZES. We'll explore what causes it, how it affects the body, and what can be done about it. Get ready to journey through the intricate world of gastroenterology. So, what triggers this syndrome? The primary culprit is a tumor called a gastrinoma. These tumors, often located in the pancreas or duodenum, that's the first part of your small intestine, produce excessive amounts of a hormone called gastrin. While it's rare, it is possible for gastrinomas to develop in other locations, though this is much less common. The exact reasons why these gastrinomas form in the first place are still largely unknown, making it a complex puzzle for researchers. Now, let's talk about how gastrinomas wreak havoc. The excessive gastrin released by these tumors causes the stomach to produce far too much hydrochloric acid. This hyperacidity overwhelms the stomach's protective mechanisms, leading to peptic ulcers in the stomach, duodenum, and even the jejunum, a section further down in the small intestine. The high acidity can also inactivate digestive enzymes, particularly those from the pancreas, impairing nutrient absorption and causing diarrhea. Think of it as a cascade of digestive disruptions, all stemming from that excess gastrin. Zollinger-Ellison syndrome is a relatively rare condition. It affects roughly 1 to 3 people per million each year. While it can occur at any age, it's most commonly diagnosed between the ages of 30 and 50. Men are slightly more likely to develop ZES than women. There is also an association with multiple endocrine neoplasia type 1, or MEN1, a genetic disorder, which increases the risk of developing gastrinomas. What are the warning signs? The most common symptom is persistent abdominal pain, often described as burning or gnawing. This is due to those peptic ulcers we mentioned. Frequent diarrhea is another telltale sign, stemming from the impaired digestion. Other symptoms can include nausea, vomiting, heartburn, bleeding in the digestive tract, and even weight loss due to malabsorption of nutrients. Because the symptoms are similar to other conditions, diagnosis can sometimes be delayed. Diagnosing ZS usually involves a combination of tests. First, doctors typically measure gastrin levels in the blood. Elevated gastrin levels are a strong indicator, especially when combined with high levels of stomach acid. Next, a secretin stimulation test might be performed, where secretin is injected and gastrin levels are monitored. In ZES, gastrin levels will usually rise significantly after secretin injection, whereas in healthy people it lowers. Imaging techniques like CT scans, MRI, or endoscopic ultrasound are used to locate the gastrinoma itself. Upper endoscopy with biopsies may be needed to confirm the presence of ulcers and rule out other conditions. While there aren't specific types of Zollinger-Ellison syndrome, the condition can be classified based on whether the gastrinomas are sporadic or associated with MEN1. Sporadic gastrinomas are more common and occur without any known genetic predisposition. Gastrinomas associated with MEN1 are part of a broader endocrine disorder and often involve multiple tumors. The primary goals of treatment are to control the excess acid production and, if possible, remove the gastrinoma. Proton pump inhibitors, or PPIs, are the mainstay of medical management. These powerful medications effectively suppress stomach acid production, providing relief from symptoms and allowing ulcers to heal. If the gastrinoma can be located and is not associated with MEN1, surgical removal is the ideal option. For metastatic or unresectable tumors, chemotherapy or targeted therapies may be considered to control tumor growth. Management of MEN1-associated gastrinomas is more complex and often involves a multidisciplinary approach. Unfortunately, there's no known way to prevent Zollinger-Ellison syndrome, especially in cases where it arises sporadically. However, individuals with a family history of MEN1 should undergo regular screening for endocrine tumors, including gastrinomas. Early detection and management of MEN1 can help prevent complications associated with Zollinger-Ellison syndrome. The prognosis for Zollinger-Ellison syndrome varies depending on whether the gastrinoma can be surgically removed. If the tumor is localized and can be completely resected, the prognosis is excellent. However, if the tumor has metastasized to other organs, the prognosis is less favorable. Recent research focuses on improving imaging techniques for early detection of gastrinomas and developing more effective targeted therapies for metastatic disease. Studies are also underway to better understand the genetic factors that contribute to the development of gastrinomas, which could lead to new preventive strategies in the future.